Well, have you had problems sleeping, which causes you to be tired and irritable and even have difficulty concentrating the next day? Well, you could be suffering from insomnia. Here to offer advice is Dr. Jovan Baker from Baptist Health Family Clinic, Salem Road in Conway. Dr. Baker, good morning.
Good morning.
So we have been talking about this for quite some time.
Yeah.
Is there a difference between having a hard time falling asleep and insomnia?
No, so insomnia actually is, for some people, they have difficulty falling asleep. Others have difficulty staying asleep, and then some more will have difficulty, or they just wake up too early. Nonetheless, they all result in the next day, you're just completely exhausted and you can't really function. So, and that's important because when we sleep, that's when our body rests and recharges for the next day.
So what are some causes of insomnia?
Some common causes would be just certain habits, like smoking or drinking alcohol too close to bedtime, some medical cases like anxiety, depression, sleep apnea, and then, of course, there's stress. And who doesn't have stress?
So what are some ways to treat insomnia? I've tried cherry juice. I got that from TikTok. I've tried ashwagandha. You have the sleep aids, melatonin, that sort of just makes me really groggy the next day.
Right. So certain things work for different people, but the most important thing is you have to identify what the cause is. So if it's a medical condition like anxiety, then you've got to treat the condition. But the first-line treatment for insomnia otherwise is called cognitive behavioral therapy, or CBT. I know it's a mouthful, but basically a therapist will identify what are the thoughts, the negative thoughts and habits that are keeping you up at night. And then they will replace those thoughts and habits with things that will allow you to fall asleep.
And then you just mentioned that if you have trouble turning off your brain at night, that is actually anxiety.
Yes, exactly. So then you would treat the anxiety. But then these habits and these thoughts, there's some breathing techniques, will actually help you to calm down as well.
Are you talking about counting sheep?
Yeah, something like that.
Okay.
So the reason why CBT, though, is the #1 treatment is because it's safe and it works. Unlike some of these medications that can have some pretty bad side effects and tend to be addictive.
Now, can you give us an example of CBT?
Yes, of course. So sleep hygiene is just a set of habits that promote sleep. My favorite is 10-3-2-1 rule. So 10 hours before bedtime, no more caffeine.
Okay.
3 hours before, no food and no alcohol.
3 hours?
Yeah, which can be hard for some people. 2 hours before, stop working, and 1 hour before, no more screen time. So that means put down your phones and turn off your TV.
Oh,
it's time to wind down.
It's going to be hard putting that cell phone down.
It's going to be hard for a lot of people. You're right.
And you mentioned sleeping pills. What about the side effects?
Okay, so yes, some of them do tend to have some pretty bad side effects. In the elderly, they can cause falls. Some people have been known to sleepwalk or even drive in their sleep. So, but there is a place for them. If these behavioral changes aren't sufficient, then we can at that time prescribe you a medication. I tend to stick with melatonin-like medications because they have less side effects, but there are a slew to pick from. But the most important thing is this is meant to be short-term, just to get you through, you know, like a rough patch in life.
All right, Dr. Baker, thank you so much for your tips and advice this morning. If you would like to contact Dr. Baker, you can do so by heading over to BaptistHealth.com and giving her a call at 1-888-BAPTIST.